Welcome back to Drugs and Behavior with Dr. Goodin. Today we'll be talking about Chapter 9, Chronic Alcohol Abuse and Alcoholism. Chronic means long-term. Alcohol is very easy to obtain. So an alcoholic is someone who is addicted to alcohol. There is no age limit, gender, employment, style, or level. Alcoholism cuts across demographic lines. 4 basic life problems associated with alcohol consumption include the following. First, problems associated with the preoccupation with drinking. Second, emotional problems. Third, vocational, social, and family problems. And fourth, problems associated with physical health. Alcoholism is a complex phenomenon with psychological, behavioral components, social components, and physical components. It becomes a problem when preoccupation with drinking alcohol becomes the priority of life. The person deals with anxiety and stress, feels fortified before social occasions. Eventually, drinking becomes a routine rather than a social affair. Symptomatic drinking means drinking to relieve symptoms such as the stress of a long day at work. Alcoholics may drink every day or may be binge alcoholics. At-risk heavy drinking is defined as more than 4 drinks on any day or more than 14 drinks per week. That's for men. And for women, more than 3 drinks on any day or more than 7 drinks per week. Alcoholics are often thought to lose control over their drinking, craving a drink and frequently engaging in compulsive behavior related to alcohol. They may stockpile liquor, sneak drinks, focus on the possibility of drinking, and focus on ways to rationalize drinking. The idea of no drinking at all is called abstinence, and the belief about the need for abstinence often determines the type of treatment given to the client. Chronic alcohol intake produces depressive symptoms. Problems may include job loss, domestic instability, and family violence. Heavy drinking is linked to a physical shrinkage of brain matter, particularly in regions associated with memory and other cognitive functions. Other physical issues involve chronic liver disease. Denial is common among alcoholics, resisting the reality that they've lost control and their drinking is influencing the rest of their life. They resist discussion of alcohol as a problem. An alcoholic's family may also be in denial and may serve as enablers, enabling the alcoholic to function as an alcoholic rather than a sober person. Alcohol abuse is characterized by either the continued use of alcohol for at least 1 month, despite the knowledge of having a persistent or recurrent physical problem, or some difficulty in social or occupational functioning, or the recurring use of alcohol in situations such as driving, when alcohol consumption is physically hazardous. Alcohol dependence involves 3 of the following 7. First, consuming alcohol in greater amounts or over a longer period of time than the person intends. Secondly, a persistent desire or 1 or more unsuccessful attempts to cut down or control drinking. Third, a great deal of time spent drinking or recovering from the effects of drinking. Fourth, alcohol consumption continuing despite knowledge that drinking either causes or exacerbates the current physical or psychological problems. Fifth, major social, occupational, or recreational activities given up or reduced because of alcohol. Sixth, marked tolerance or the need to drink more than before to achieve previous levels of intoxication. And seventh, symptoms of alcohol withdrawal or the consumption of alcohol to relieve or avoid withdrawal symptoms. Over 15% of men and 10% of women in the U.S. have met criteria for alcohol dependence. With increased tolerance, the ingestion of greater amounts of alcohol to receive the same benefits may cause greater physical problems to the body. Withdrawal effects of alcohol can be described as two clusters. The first cluster is called alcohol withdrawal syndrome and is more common. It begins with insomnia, vivid dreaming, and a severe hangover. These discomforts are followed by tremors or the shakes, sweating, mild agitation, anxiety or the jitters, nausea and vomiting, and an increased heart rate and blood pressure. They may sometimes have brief tonic, clonic, or grand mal seizures, as the nervous system rebounds from the chronic depression induced by alcohol. Withdrawal syndrome usually reaches a peak from 24 to 36 hours after the last drink is over. The second cluster is called delirium tremens and is much more dangerous but less common. Symptoms include extreme disorientation and confusion, profuse sweating, fever, and disturbing nightmares. They may have periods of frightening hallucinations. Withdrawal effects peak 3 to 4 days after the last drink, during which time there is a risk of life-threatening events such as heart failure, dehydration, or suicide. Hospitalization is necessary. Anti-anxiety medicine is commonly used for people in alcohol withdrawal during this time. Chronic alcohol use leads to a fatty liver due to fatty deposits inside liver cells. Fats accumulate and ultimately interfere with the functioning of the liver because the liver is breaking down the alcohol rather than the fats. Alcoholic hepatitis is an inflammation of liver tissue causing fever, jaundice, and abdominal pain, resulting at least in part from a lower functioning level of the immune system. The third most serious liver condition is alcoholic cirrhosis, characterized by the progressive development of scar tissue that chokes off blood vessels in the liver and destroys liver cells by interfering with the cell's utilization of oxygen. Unlike the first two types of liver damage, alcoholic cirrhosis is not reversible during abstinence. Byproducts of alcohol molecules are toxic to the liver. 1 in every 4 alcoholics develops cardiovascular problems characterized by inflammation and enlargement of the heart muscle, poor blood circulation to the heart, irregular heart contractions, fatty accumulations in the heart and arteries, high blood pressure, and stroke. The quantity and frequency of drinking far exceeds standard or moderate alcohol consumption. Chronic alcohol abuse is associated with several types of cancers, particularly in the pharynx and larynx. Liver cancer is also common, as is breast cancer in women. Although alcohol is not a carcinogen, its weakening of the immune system allows other carcinogens to do more damage. Alcoholic dementia involves enlargement of the brain ventricles, a widening of fissures separating sections of the cerebral cortex, and loss of acetylcholine-sensitive receptors, resulting in a decrease in brain mass and a decline in overall intelligence, verbal learning and retention, and short-term memory. Reversal of damage is more likely in younger individuals. Wernicke-Korsakoff syndrome is a two-part disease. Wernicke's encephalopathy involves the patient showing confusion and disorientation, abdominal eye movements, and difficulties in movement and body coordination, usually as a result of vitamin B1 deficiency. Many neurons die in areas of the brain specifically concerned with thinking and movement. They may be treated with thiamine supplements. This may be concomitant with a severe form of chronic amnesia and general apathy called Korsakoff's psychosis. Patients cannot remember information that has just been presented to them and have only memory for distant events that occurred prior to their alcoholic state. They frequently attempt behavior called confabulation to compensate for their gaps in memory by telling elaborate stories of imagined past events as they try to fool others into thinking that they remember more than they actually did. Fetal alcohol syndrome is a unique situation. A fetus is extremely susceptible to alcohol as it is not developed enough to break alcohol down properly. Alcohol is teratogenic in that it produces specific birth defects in offspring by disrupting fetal development during pregnancy, even when differences in prenatal nutrition have been accounted for. Fetal alcohol syndrome children often suffer from short-term memory, problem solving, and attentiveness later in life. Present-day diagnoses of the fetal alcohol syndrome include prenatal or postnatal growth retardation, which the child's weight or length is below the 10th percentile, evidence of CNS abnormalities or mental retardation, and these characteristics. Faces appear that include smaller than normal head, small, wide-set eyes, drooping eyelids, a flattening of the vertical groove between the mouth and nose, thin upper lip, and a short, upturned nose. If only some of these characteristics are observed, the condition is referred to as partial fetal alcohol syndrome. Incidence is greatest among Native Americans. The groupings of fetal alcohol diseases are known as fetal alcohol spectrum disorders. The greatest risk is in the first trimester of pregnancy, especially the third week of gestation. Fetal alcohol syndrome is the third leading cause of mental retardation in the Western world, despite being preventable. Expenses of alcohol abuse include treatment for alcoholism, medical intervention for alcohol-related diseases, lost productivity from absenteeism, decreases in worker performance, treatment for alcohol-related injuries, lost value of future earnings of individuals who die prematurely, estimated at $224 billion annually, more than three-fourths of the cost, and more than half the deaths are specific results of binge drinking. Men are more likely to binge drink, while women are more vulnerable to alcohol-related organ damage. 9% of the elderly have alcohol problems. Alcoholism among the elderly is exacerbated because the biotransformation is slowed. Alcohol may complicate other issues, interacting with other medications, other medical conditions, and other cognitive disorders. Alcoholism affects the whole family. A systems approach advocates looking at how the alcoholic and other members of the family interact. Codependency has gained widespread attention as a way of understanding people who live on a day-to-day basis with an alcoholic or any individual with a drug dependence. There may be an over-involvement with the alcoholic, obsessive attempts to control the alcoholic's behavior, strong reliance on external sources of self-worth, through the approval of others, an attempt to make personal sacrifices in an effort to improve the alcoholic's condition. The codependent often believes that he or she is responsible for the behavior of the alcoholic. There is special attention paid to children of alcoholics because they have a higher statistical risk of becoming alcoholics than the children of non-alcoholics on genetic and environmental bases. Alcoholism does run in families. Type 1 alcoholics develop problem drinking later in life and generally function well in society. Type 2 alcoholics develop alcoholism earlier in life and have significant antisocial patterns of behavior, evidencing a genetic component. The concordance rate of a twin study shows that if one twin is an alcoholic, another twin is 50 or 60% likely to also be an alcoholic. Societal views are changing towards the alcoholic, supporting treatment rather than punishment. However, as with obesity as a disease, the burden on physicians is emphasized. Different treatments are useful for different subgroups. Early biological treatment in the form of antabuse can be used to produce an aversive reaction that decreases alcohol consumption, but compliance rates are low. Newer aversive treatments can be administered monthly. Other treatments focus on the regulation of GABA. while others have shown the usefulness of anticonvulsant medications. Other treatments focus on serotonin levels and abuse. Zofran is used to reduce serotonin levels and drinking behavior. The best-known treatment program for alcoholism is Alcoholics Anonymous, or AA. AA involves a 12-step program wherein members acknowledge a powerlessness over alcohol, that their lives are unmanageable, and they must turn their will and their lives over to the care of God as they understand Him. There is a strong spiritual component, but the definition of God is very abstract. Anonymous meetings are somewhat akin to group therapy, with members recounting their personal struggles with alcohol, their efforts to stop drinking, and their support for fellow alcoholics and their own struggles. Sponsorships are emphasized, and it is not uncommon for members to attend daily. AA believes that an alcoholic is never cured, but is always recovering. Relapse from sobriety can occur at any moment. Research on AA is somewhat missing due to the anonymous structure. It employs 4 factors that are widely shown to be effective in preventing relapse and alcohol dependence. 1. The imposition of external supervision. 2. The substitution of dependence on a group activity for dependence on drug-taking behavior. 3. The development of caring relationships. 4. A heightened sense of spirituality. An alternative is the smart recovery, which assumes that people don't need to believe they are powerless over alcohol or submit to a power greater than themselves. Instead, the emphasis is that individuals have the power in themselves to overcome anything, including drinking. It is based on rational emotive behavior therapy and emphasizes rooting out irrational thoughts, emotions, and beliefs that prevent the achievement of personal goals. It insists on professional involvement in this program. Now, alcohol is common in the workplace, especially within 2 hours of working. It is more common among men, younger people, white people, and service and entertainment industries, as well as blue-collar jobs. Employee assistance programs, or EAPs, and member assistance programs, MAPs, increase the productivity of the organization and the welfare of the individual worker with a thrust of workplace interventions to change the culture of drinking within the organization. I'll see you in Chapter 10. Thank you.